For many, many years, it was this big place where they did farming and raised cows and chickens and crops, and the residents just kind of lived there. And there was no expectation that anybody would ever leave or would ever get better. But then this idea that people can grow and have all this sort of endless potential of what we now call the recovery model. And the other thing that really changed along with that was bringing in advocacy groups to talk to the patients, people with their own lived experience, what we now call peer support, where you have someone in recovery now helping someone else, because then you really show people like face to face what recovery can look like.
Welcome to Normalize the Conversation. I'm your host, Francesca Reicheter, and today I'm joined by Dr. David Susman, a licensed clinical psychologist, mental health advocate, executive advisor for clinical services in Kentucky's Department for Behavioral Health, and author of a mental health blog at davidsusman.com. In this episode, David challenges the traditional psychiatric model, and he makes the case for a recovery-focused care. He explains why peer support, empowerment, and a person-centered approach are essential for long-term healing, and what needs to change in our mental health system to make it happen. Thank you so much for joining me today. I am super excited for our conversation, but before we begin, I just want to check in. How are you really?
I am really doing pretty well right now, all things considered. I'm happy about a little better weather, and I'm happy about seeing some friends recently, and feeling like things are moving in a good direction.
Oh, that makes me so happy to hear. I'm also doing pretty good. I moved to California very recently in the past 2 months, and I finally feel like I've adjusted. And it's sunny today for like the first time, which is really great. And 2 weeks ago, I started going over to the UCLA Psychiatric unit and reading with the young kids, sharing kind of my story and my journey with the adolescents. And it made me so much more eager for our conversation today, because being in a psychiatric unit, then seeing kind of like the environment of others, hearing about this modernized version that you've been part of, I'm so excited to hear about the progress, because it's something that I didn't know existed, but it was something that I just knew was needed.
That's great. I'm curious, just what kind of reaction do you get from the kids?
The young kids love it. There was one who said to me when I was leaving, "That's tragic. I wish you could stay." And that warms my heart. And then the adolescents, some of them are so like eager to hear about it and talk and create conversations. And some of them are like, "Oh, there was an example of something you're excited and looking forward to." And I said, "Oh, I'm going to have chocolate cake tonight." And one of the teens was like, "We're not allowed to have chocolate cake here." So I've learned that it's not, I knew it wasn't fun. It's like, actually, I've been there. But I learned that it is very sad when you hear about things happening on the outside and you feel like your environment doesn't have something that makes you excited.
Right. Yeah, for sure. Well, I'm sure that's really rewarding for you and for them. That's really great to hear.
Yeah, because my experience in the psychiatric unit, we didn't have that. And our walls were so beige, the environment felt so dark, and I felt so kind of isolated and didn't feel like a human being, to be completely honest. And that's when I realized how much the system needs to change, how much we need to make sure we are making steps forward in progress instead of sitting in a older version that's not setting patients up for success with the actual resources they're providing as well as the environment.
Yeah, and I think, as you already know, I worked in a psychiatric hospital for quite a while.
Yeah. And you've been part of this hospital that's created this modernized version, and I'm so excited to learn more about it.
Yeah, I'll tell you a little bit about that, because I think the story is pretty interesting. I live in Kentucky, and our local state psychiatric hospital just had its 200th anniversary last year in 2024. So it opened in 1824. As it turns out, it's the second oldest state psychiatric hospital in America. And its sort of journey over 2 centuries reflects the journey of mental health care, because for many, many years, it was this big place where they did farming and raised cows and chickens and crops, and the residents just kind of lived there in this sort of farming-like community almost. There was no modern treatment as we know it today. And that actually went on for 130 years, maybe, until about the 1950s, because that's when we saw the first modern medicines arrive. The first one on the market was called Thorazine, and that was the first medicine that could actually treat people who were having symptoms of psychosis. So that was a game changer. And then in the 50, 60 years since then, we've seen this huge advent of many more medications, psychotherapies, rehabilitative kinds of therapies, and our system of care has really gotten a lot better. So I arrived on the scene as a young clinical psychologist just out of school. And, at that time, which was, I worked there 24 years, I guess. So I was there a long time, but things were already much, much, much better. But then during the time that we were there, we started seeing this advent of what we now call the recovery model. And so that was a novel idea, that you would have people with sometimes very lifelong, severe kinds of mental illness who actually could recover to a point where they were leading really fulfilling and productive lives, because that was not the model. Before, it was just what they called this custodial care, where people lived on this giant sort of farm for years, and there was no expectation that anybody would ever leave or would ever get better. So, we've come a long way, and, I can say kind of a lot more about that kind of journey, but I think it's just interesting how, despite the limits that we have still in the system, we have come so far from the way things.
I didn't realize that. I don't know why I didn't realize it, but that psychiatric medication is so kind of new still. It's only like 70 years in the making.
Yeah. I mean, imagine having no medicine,
Yeah.
There were no modern medicines. And so when you look at how the pharmaceutical industry has got all these miraculous medicines now for many, many medical and mental health issues, we think about the advance of science, and that has been, amazing.
It makes sense why it's so far kind of behind physical health in many ways, because we're playing catch up.
Yeah, that's right. Because, you think about, some medical medications have been around for a really long time, and some of those were groundbreaking too, like when insulin first came on the market for diabetes, or, when they figured out how to vaccinate for polio or smallpox. But, all those things have been around actually a bit longer than some of our modern psychiatric treatments.
Wow. I really didn't realize that. But hearing that, I mean, you can see a lot more progress when you put it in context, but also to hear about this recovery model, because so many places have not begun to adapt. And a lot of that honestly does come from funding. Privatized hospitals don't necessarily put a lot of money toward mental health. A lot of states don't always put a lot of money toward those state mental health facilities. So when funding is low, it makes sense that it's hard to revamp when you're trying to put a lot of funding toward making sure the medications are available and that there's staff available and there's beds available. But to hear that there's been this shift in the recovery model, as well as we've seen a huge shift in conversation, in reducing the stigma, in changing language, that is just unbelievably amazing.
Yeah, and I saw a lot of that firsthand, because when I first started working in the hospital, even then recovery wasn't really talked about a whole lot. But then this idea that people can grow and, have all this sort of endless potential, if you will, to achieve a lot of their dreams, that was a new part of the conversation. And the other thing that really changed along with that was bringing in advocacy groups. You're probably familiar with National Alliance on Mental Illness, NAMI. and Mental Health America. And, a lot of these groups that do really great things, but to have them come into the hospitals and begin working hand in hand with, health professionals, because the one thing they did, which was really a game changer, is they brought in to the hospitals to talk to the patients, people with their own lived experience. And so this is where we saw the beginning of, what we now call peer support, where you have someone in recovery now helping someone else, but that's not quite as far along in their recovery. And that's a pretty miraculous thing to see, because, I may be like a semi-smart guy who's been to school for a long time, but, I can't have that like peer-to-peer conversation to say, oh yeah, I've had bipolar disorder for many years, and let me tell you the things that work for me. And then to see that person on the other side who's still in the hospital, just immediately connect with them and say, oh wow, this person really does know what I'm going through because they've been through it themselves. So I think having the advocacy groups come in, having the peer support folks come in, having that voice of just the consumer come in, to me, that was one of the most groundbreaking changes I ever saw, because then you really show people like face to face what recovery can look like.
Yes, exactly. So I do go with NAMI Westside Los Angeles, 2 people from there, to the psychiatric unit on Monday. And it is so amazing. It really makes a difference. And that's what one thing that really was, so many things, but one thing that was really, really missing when I was in the psychiatric unit was that peer component, right? Knowing that someone else out there understood, went through it, and has made it to the other side enough to want to live, right? Because that's not where I was at that time. I couldn't imagine ever getting to a place where I wanted to be alive, let alone was making steps toward learning about things that I can do, like coping skills, self-care practices, medication, therapy. I could not have imagined that at that time. And had I had someone who's gone through it, who knows, who could talk about these symptoms, and I could feel for the first time in my life that someone related, that someone understood that it can get better, that I can live a productive life and still be a valued member of society, because all the messaging I had received up until that point was this diagnosis will prevent you from doing anything and being anything. So I really love that peer model.
Yeah, and I think, we all need role models, peers, mentors. We need those people in our lives that can sort of lead by example and show us what they've been through, because that can be way more powerful than just somebody giving you advice that maybe you didn't even ask for, or saying, well, go take this pill or go, whatever. It's like, it's a very different thing to see someone who you identify with, who has been successful, that you can relate to and say, well, wait a minute, if they can do it, I can do it too. And so, yeah, that's really, really compelling. I want to go back to the other thing you said, which, about funding, because, the hospital I worked in, keep in mind, this was a state-funded psychiatric hospital. So this was a not-for-profit public hospital. It was not a fancy private hospital by any means. And so with state government facilities, there's always limits on funding. They struggle sometimes for funding. And so to see these kind of advances that we were able to make, and really bringing that philosophy of recovery in a setting where, it wasn't the most luxurious or the most plush setting. By the way, the hospital where I worked was in the same location for the first 185 years, 190 years. And it was like not really glamorous. There were a lot of old buildings. And so the setting would not suggest to you, oh, wow, this is, like the Maserati of recovery settings by any means. But, the interesting footnote to that is the state legislators and the advocacy groups, everybody got together and they said, we ought to really replace this 190-year-old hospital. And so they got money to build a brand new one. And so in 2013, the brand new replacement hospital opened which does look like the Maserati of recovery. And it's beautiful, and there's light coming in through all the windows. I mean, you would really think you're at like, the, Hyatt Regency. I mean, it's just a beautiful facility with lots of natural light and a really healing kind of environment. And so, we already had really good therapeutic programs, but then when you put that in now a beautiful, positive, light-filled environment, it just makes the impact even greater. And, a lot of that was done still with limited state money, state funding and budgets, but it also shows that you can make change if everybody's committed to doing that. And so I think we were able to see how you can really revolutionize not only your treatment philosophy, but also you can create a whole new environment.
Yeah. So although funding is difficult to come by, it's not necessarily a complete excuse to not start making those changes. I love that.
That's right.
And the natural light. That was the thing when I was there. The windows, there were very few and they were very, very thick, so you couldn't see out. And it felt so dark and gloomy. And when I say I could not imagine a place darker than my brain, when I walked into those doors, I was like, wow, it's darker here. And that made the journey, it made it feel so much more impossible while I was in there. And to hear that shift to natural light, oh my goodness, I bet that really does just, light helps. Having some sunlight, I know when I see the sun, I instantly feel just a tad bit better.
Yeah, well, and we know sunlight also gets you some more vitamin D, and that's good for you. And, you feel better. And, the light itself is a healing factor. We have so many symbols throughout history of, light being associated with warmth and with wellness and with healing and, all those kind of things. So the environment, our natural environment, and sometimes our therapeutic environments really make a huge difference in how we thrive.
Absolutely. It really does. In an environment where you feel like you matter, an environment where you feel light that shows a sense of hope, really can make all the difference. And then having those peers in there, having that place where not only does your physical environment, but your kind of like emotional environment, seeing the people around you in there who can inspire and spark that bit of hope. That's something I wish I had so much. And it makes me so happy to know that other people are starting to get that, because it would have made all the difference. And I hope we continue to see these shifts.
Yeah, absolutely. And another thing you mentioned, which I think for a minute, is kind of how we talk about recovery and treatment and so forth. We also kind of went through a big overhaul in terms of a lot of our language. And, one example was we used to talk about people would have like a case manager or something like that in the hospital. And we started saying, well, what if we just called it like a recovery coach? And so they said, oh, well, that's a whole different feeling, right? And you still hear the term case manager. Obviously, I'll admit it's not one of my favorite terms, because I actually had somebody say to me, I'm not a case and I don't need to be managed. And, there's truth to that. But, if somebody says to me, I want to be working with you, I'm going to be your recovery coach, I'm going to think, oh, well, okay. So they're going to be like showing me the playbook, and they're going to be teaching me the strategies, and they're going to be like helping me toward this type, they're saying recovery coach. So that makes me think they think recovery is something that could happen if they're going to coach me toward that. So even just those little shifts that you make in terms of how you talk about treatment, how you present different kinds of things. Another example you probably heard a lot of times, what do you say if somebody refuses to take their medicine? What do you call them? There's a lot of words. The ones that come to mind are like, they'll say, well, they're resistant or, uncooperative. The other one that comes out a lot is non-compliant.
Oh, yes.
They're non-compliant with their medicine. And, that's negative. And why don't we, instead of saying non-compliant, why don't we just say, what can we do to engage someone better in their treatment? We don't have to say they're non-compliant. We don't have to say they're resistant. We don't have to say they're uncooperative, any of that stuff. It usually means that some factors are at play, which makes them think maybe this is not the best choice for me. Maybe this is not the medicine I want, or maybe this is not the kind of treatment I want. So for me, that's a signal for me. If I'm their therapist or their psychologist, whatever, I'm going to think, what can I do better to engage them in treatment to where we can come to some collaboration on some things that we can talk about and we can agree on. Let's look for points of agreement. And so that's just another example. But I really do think how you talk about treatment and recovery can lend a negative connotation, or it can lend a much more positive healing connotation.
That is so true. The case manager. Yeah, because I remember feeling really frustrated, like I was just part of a system. I didn't feel like I was an individual. And I like the idea of recovery coach because that shows motivation. It shows that someone's there alongside of me. That's what I think of as a coach. Think of someone who's there, who's teaching me, who's helping me, versus a case manager I see as someone who's just looking at me as like a number that's just going through the system. So I love that. And then also non-compliant to how can we support them is so important because, first of all, taking psychiatric medication because of the stigma can feel very scary, right? And there's side effects that you don't know about that you've heard based on the stigma. Everyone's talking about these big side effects, and some of them may. And it's scary when you have to try something and then the first time it does have a side effect that you don't like, and then to trust that another one may help you. It makes sense. Like, it absolutely makes sense. So being able to recognize how can we support them in this journey and make them feel like we're not just throwing medication at them because we don't want to deal with them or we want to take away their personalities. That's a big thing I've heard. Being able to this is a really great tool that may be very beneficial for you. Here's how we can support you in trying something new.
Yeah, so let's talk about the stigma for a minute. So, if you break stigma down as far as toward mental illness, it's typically like negative attitudes, negative thoughts, negative beliefs, right? Well, there's another word that also means negative attitudes, negative thoughts, and negative beliefs towards someone, and it's called discrimination.
It's true.
And so I really think at the heart of it, when we talk about mental health stigma, we are talking about forms of discrimination in some cases because people are not treated fairly. They're not given advantages. They are denied privileges in some ways. And so I think we sometimes need to broaden the conversation of stigma and say, this is in some ways really is discrimination based on the fact that someone carries mental health diagnosis. And so that's really, it's really troubling at a deep level if you think about it.
It is discrimination and stereotypes because people assume that someone must behave a certain way based on what the media shows us, right? We watch TV and it's always I think the Joker was a big example, right? It's always someone with a severe mental illness that has to be the villain. And it's so frustrating because what if we show that they're actually just someone who's struggling and needs support, right? And that instead of isolating them, instead of them being a killer, what if they were just someone who was struggling and someone sat with them and helped them through a panic attack or talked to them about medication? Something that could be such a small shift could change the way people view mental health, right? The initial messaging they're getting from it, and then wanting to reduce the stereotypes and reduce that discrimination because we know that this person isn't quote unquote crazy. They're a human being and human beings need to feel loved and be loved and deserve to be loved.
It's so true because, you think about so many people are they're invalidated in different ways and people tell them in different ways, well, you don't matter or you're not as meaningful or you're not as successful or, you're not as whatever. And then if you're struggling with emotional concerns, mental health concerns on top of all that, which may also increase things like you withdraw from others or you're sad or you don't want to get up and do things or you don't want to go to school or you don't want to go to work or whatever, it just reinforces then people, assume that you're not trying hard enough or you're not as productive or, all those assumptions start coming into play.
Yes, lazy is a big word, right? They don't want to. I remember when I was having severe panic attacks, I would end up in the hospital as a kid all the time, and they'd be like, nothing's wrong. They would pump me full of steroids because like her chest wall was inflamed. And then they'd send me home and be like, she just doesn't want to go to school. She probably doesn't want to take her math test. And I loved school. I was so happy to take my math test. It was my favorite subject. There was no reason for them to be attacking me that she just doesn't care. She just doesn't want to, right? She's not getting out of bed and doing her homework because she's lazy. Those messages really, I internalized them too. So then I went on the complete opposite side of the spectrum and I kept pushing myself to prove that I wasn't lazy, to prove that I was good enough, to a place where I was constantly burning myself out and making myself physically sick.
Yeah, and that's another great example we call a self-stigma, because you took those messages, you brought them inside, and then you started thinking of yourself in a negative way.
Exactly. And it's so frustrating because so much of the messages become internalized. And then when we feel, at least for me, when I felt very stuck in it, it was so hard to want to give myself any credit for anything. For those days that I got out of bed and made the bed, right? That was something that was really huge in that moment because I did not really have the energy to and I did not want to. But instead, it was like I'm doing the bare minimum to exist, and that's not good enough. So it's the way we talk about it is so incredibly important. It can shape, at least for me, it can shape the way I view myself for a very long time.
I think of that kind of analogy, if you've got the house plant and it's withering and it's, not doing too good, you give it water, you give it sunshine, take it out for some fresh air, you give it things that are going to help it grow, right? And so people are no different. If we see a person withering in the corner, they need some support. And I think that's the other thing I encounter a lot is people will say, well, I don't know how to support somebody. Well, yeah, you do. It's not hard. A kind word, you say, let's go out for a walk, or can I watch your kids, or can I help you, get some dinner, or, can we just like watch a funny movie together? I mean, you and me could come up with like 500 ways, right? And they're not that hard, and just those little things make a big difference.
Yes, and that's a big thing is a lot of people often feel that it has to be this huge gesture that saves someone. So then they don't even make any steps because they're like, I can't do this. And it's a phone call to say, how are you feeling? What's going on? What have you been thinking about lately? It's just that hug or touch on the shoulder that lets you know that you're not alone. It's that invite to dinner, even though they know you may not go. Knowing that someone still cares enough to invite you because they want you around, it makes all the difference. And when there's this misconception that it has to be this huge gesture that has to save someone, and you feel like, well, I don't know how to do that, so I'm not going to do anything, the person struggling just feels they're already self-isolating, likely. I was self-isolating, and then I feel like everyone around me was pushing back and away from me because they didn't know what to do or what to say, or they felt like they didn't know what to do or what to say. So then it like reinforced this idea that I don't matter, I'm not good enough, I don't belong. And that was really hard.
Or, I know you're familiar with this, like write somebody a little handwritten note.
Yes.
Give them a little card. And I've had people like you get a little handwritten note and it's so positive and it's so affirming, and they put it up on the fridge or they keep it for years or forever. Because how many times in our world today do you get like a nice positive handwritten note?
Yes, exactly. And that's where the encouragement card program came from. I coping skill for a while, and then I had 100 cards in front of me and thought, wow, it would have been so great to receive this back then. And so sometimes I'll go drop them off in person when I'm in Florida because that's where most of them go. And the security guard at Memorial Hospital said people actually come back with their card. And so they seek help again because they received that message. And that really, really I can't even describe the feeling I had in my heart when I heard that, because it's so true. That message of encouragement, that message of hope, that feeling that you're not alone, a little bit of color in those darkest moments really are the difference between I can't do this anymore and maybe I can try again. Maybe I can take one more step forward. Maybe I can make it through today.
Yeah, and I think, so much of where we get to with mental health issues is people get disconnected. They get disconnected from friends, family. Sometimes they're disconnected even from their care providers, treatment providers, and they get really isolated. And then you get really sad, and then things can spiral quickly in a really negative direction. So, if we can reverse that, if you can increase connection in some way, and part of that may be the card, or part of it may be just spending a little time with somebody, or part of it may be just, helping them get in a support group, or maybe going to a NAMI meeting or whatever, but to begin to increase those connections again, it brings people back into the fabric of community.
Yes, and community is so important. It's that feeling that you belong, that you have a place in this world. And I know for me, one of the things that helps me so much to this day is when my friends send me a random text that are like, thinking about you. I just want you to know that you matter, that I'm so proud of you. And for them, that's like a 2-second message that they sent. And for me, that's the message that's in my head for the rest of the day that's making me smile. And they always send it at the right time. Always at the right time. That just really gets me in that moment where I'm like, I needed to hear that message. And instead of isolating myself, I respond and we have a conversation. I pick up the phone. I stand up and start working on something and feeling connected to myself and to the world around me. So that sense of community really makes all the difference.
And I think just the positivity, the more we can bring positive things to people. There's a really cool researcher who works with couples, who are married or in a serious relationship. And they've done all this research, but they can predict scientifically which couples are going to make it and which ones are going to split up. And one of the key things that they know is the difference is the couples that are going to make it, for every one negative thing they say to each other, they say 5 positive things. And so if you can maintain in a relationship a 5-to-1 ratio of positives to negatives, you have this statistically significant higher chance of sustaining that relationship than if you have less positives and more negatives. And so I think it's we just got to pump up the positive value of our relationships.
That makes so much sense. And I feel like I never would have thought about that. But it makes so much sense to have a little bit more positivity than negativity, right? More kindness and compassion. And that's something that that's something that we are taught in kindergarten. And then by 2nd grade, we've all forgotten it. And it's so frustrating because what if we just had one more message of encouragement and compassion in our day? What if we just had someone that we knew, no matter how bad the fight is or how isolated we feel, or how depressed or anxious, no matter what we're going through, that they really care and they're going to give us those words of affirmations that we need. It really can make such a powerful difference.
And I'm sure you see that when you go and talk with the kids or you spend time with other people who share some of their own personal struggles with you. I'm sure you see how when you give them that positive time or that positive message back in return, it's just sort of they soak it in, right?
Yeah, one thing I've been trying to remember to do every time I speak now is have people repeat affirmations after me. Because, right, requiring them to say it to themselves and to everyone around them, it makes such a difference to hear yourself say it and to hear other people say it and then to say it in a community, in a group. It's really reinforcing it. And that's what we need. We need to be able to say it to others, but also say it to ourselves sometimes because, unfortunately, people can be mean. And when they are, it doesn't need to devalue our worth as long as we can give that message back to ourselves when we need it.
So, I'm wondering, just from what we've been talking about, maybe you and I put our heads together, but how do we keep moving the needle to help people with mental illness feel more valued and to feel like we're making more strides in the right direction, or, my one thought that always comes to mind for me is, and then tell me what you think, but I always try to get people more sort of engaged in like advocacy and doing more things in the community. And I always say the two rules of advocacy. First, you have to get informed. You got to know what's going on, what the issues are that are important. But then the second thing is somehow you got to get involved. And so you have to find a group you can plug into or somebody you can go volunteer to help or some little kid you can stay with and spend some good quality time. But I kind of feel like that's the magic formula if we want to keep moving the needle is people got to better understand what's going on. And then we have to find ways for them to plug in so that their voice can really make a difference. But I don't know. What are your thoughts? You're doing all this advocacy all the time.
I like that. And I would add conversation, right? Just checking in when we talk to our friends instead of, hey, how are you? Fine. How are you? And walking away. It's how are you really? And answering it honestly, right? It's being able to, one thing I love about making my friends make encouragement cards with me, lying to them, saying they're coming over for brunch and then having everything out on the table is we start talking about it. I had one day, 3 friends over and all of a sudden they were talking about the different antidepressants that they're on. And they're like, I didn't know other people that I knew were taking it, right? And suddenly you feel so, wow, it's okay to go through what I'm going through. We can talk about what we're learning in therapy and the different modalities. I didn't realize EMDR was a thing someone said. So it was really made people feel so validated. And then when you can take that validation and know it's okay to talk about it, then learning more about advocacy and how you can get involved in continuing to talk about it on a larger scale. So for me, one thing that I'm very convinced is it all starts with answering that question, how are you, is how are you really?
And I love your normalizing it, right? You got to normalize it because we have to show people that talking about mental health is not a taboo subject anymore.
Yeah.
There really used to be a time when it was like, oh, this was like you never spoke of it. You were, all of your dark secrets were always locked away. You never had anybody that you would share that with. But thank goodness we're getting to a much more open place. And I really feel like, it's your generation and, the younger generations that have really opened that door more because, my generation, when I was growing up, it was much more of kind of like, oh no, you don't talk about that kind of stuff. But thank goodness, I think that's changing. And then once you do open that door and you start talking more openly about it and you get that reaction like, oh yeah, I've done that. I've been there. Yeah, I have ADHD. Oh, yeah, I have panic attacks. Oh, yeah, nothing wrong with that. It's like it just changes the whole landscape.
It really does. And one of the few benefits of social media, we can argue all about social media. I feel like I'm always changing my mind on it. But one of the very few benefits that I have really enjoyed is the amplification of the conversation. It's becoming a lot more widespread because you have so many advocates on there talking about it. And then you have a lot of public figures talking about it as well. And we're seeing it on a wider scale. When you see someone that you admire opening up about it, it makes such a difference. You see people talking about it online and it's okay and it's well received and so many people are doing it, then you want to do it and join the conversation too. So I think that's been a big shift for my generation and the generation below me is that these conversations are happening online 24/7 with people from around the world. And it's becoming a normal, casual conversation instead of this stigmatized, don't let someone know that you have a vulnerability or what they perceive as a weakness. Try to be stoic all the time so that you can be perceived as strong. It's really changing that messaging.
Yeah, I agree with you completely. And, you see these mega celebrities and these influencers and professional athletes, actors, actresses, even the royal family. You've got people talking openly about mental health on all these different levels. And you've got, again, a lot of maybe younger adults or even teens or adolescents or whatever. And they see that and they think, wow, well, if this person I look up to and this person that I admire is talking openly about this, it must be okay.
Exactly. So can I. And then commenting on their posts is a lot of times the first step that people take. It really has made such a difference. conversation and then having groups like NAMI who create these peer support groups, these family-to-family groups, peer-to-peer, going into these psychiatric units, really making sure that people... I'm in school to be a therapist. I love, love, love therapy. Such a huge advocate for it. However, a lot of times I've been the patient who sat there and convinced myself, and maybe the therapist does know what I'm going through, but because self-disclosure, I think it's changing a little bit now with social media and you being able to see what your therapist is posting anyways. But because self-disclosure was so limited, I was convinced that they did not know what I was going through. They didn't understand. They were seeing me as a textbook. And maybe in some cases that was true. Maybe in some cases it wasn't. It was definitely a big assumption that I was making and internalizing. But to see peers who are able to talk about it in the most honest, vulnerable, authentic way makes such a difference, because you can see yourself in that, like you said before, and you can see that glimmer of hope, right? Someone else has been there. They're going through it. They've gone through it. They're still going through it. Treatment, recovery, it's all ongoing, but it worked. There is hope in tomorrow.
Yeah, absolutely. I think another game changer has been telehealth. If you think about even just before COVID, telehealth was not as widespread as it is now. But now more and more professionals can practice across state lines. And so now, if you're in a real rural area and you can't find a good therapist, well, you can do telehealth, and there's your excellent, expert that you may be talking to out in Iowa or somewhere. And it's just opened up a lot of doors from that.
It really has. And we've seen so much progress. It's incredible, and I hope we continue to see more. But as we are wrapping up, what is one last thing you would like to leave our listeners with?
Oh, wow. Well, I've really thoroughly enjoyed this. I think I would just leave with the thought that it's great to really see this advent of how people can really embrace the idea that their mental health journey doesn't have to be as limiting as it used to be in the past, and that there are many more opportunities to achieve your full potential and to, make your dreams come true. And I think we have to just keep reminding people that those aspirations they have are not unrealistic, and to remind them that things can and do get better, and to keep reminding them that it's okay to talk about your mental health, and it's really okay to ask for help. And so if we just keep those basic messages going, I think that's going to keep us going in the right direction.
I agree. And one thing I've been really enjoying is your website, because you have a bunch of blogs. I really liked reading about the inpatient psychiatric unit that you were working at. So for those listening who want to kind of stay connected, see more about your work and what you're doing, how can they find you?
Yeah, so my name is David Susman, and my website is just davidsusman.com, and that's SUSMAN. You can find a lot of things I've written. You'll also find me hanging out to some degree on Instagram and Facebook and LinkedIn, and I also periodically do a blog on Psychology Today. So I'm pretty easy to find, and I encourage people to reach out if they have questions or things they want to talk about.
Thank you so much for listening to Normalize the Conversation. Don't forget to subscribe, rate, and review. This podcast is an initiative of Inspiring My Generation, focusing on normalizing the conversation, bringing education and awareness to the forefront, and amplifying global voices to spark change and hope. Inspiring My Generation is a 501c3 nonprofit organization on a mission towards suicide prevention through awareness, conversation, education, and support. Connect with us on Instagram at Inspiring My Generation, and visit our website, inspiringmygeneration.org, to learn more about our work and how you can make a difference.